Hi, I'm Dr. Cath Cosgrave, and I'm here for the next half an hour to talk to you about building a stronger rural health workforce by unleashing the power of Attract, Connect, Stay. I'd like to start with an acknowledgement of country. I'm coming from Gombangia country on the mid-north coast of New South Wales, where I live in a small rural town of Ballingen. I'd like to take a moment to reflect on the meaning of place and connection and recognise all of the traditional lands on which we are meeting today. And in the spirit of reconciliation, I wish to acknowledge the traditional custodians and their continuing connection to country, culture, community, land, sea and sky. And I'm paying my respects to elders past, present and emerging. Here's the common recruitment experience that my clients tell me that are health and social care managers. This is what is happening right now in your world, and this is probably why you're joining me. You have frequent or long-term vacancies, few or no suitable applicants applying. You're finding some positions are just impossible to recruit, and you may have turned to an agency or international recruiting to resolve those. You have slow and cumbersome recruiting processes. If those are an issue, you might be losing your preferred candidates. Your team is showing signs of burnout, and it feels like a revolving recruiting door for you, and you're possibly losing hope that you'll ever have a full workforce. So why addressing these recruiting challenges matters for you. It should give you back the time and headspace to plan and address important service quality issues. It should also improve your own job satisfaction. For your team, it'll improve their job satisfaction, and I'll talk to you about how important job satisfaction is and what a key issue that is for retention, because they'll feel less stressed by having a full workforce. And of course, for patients and clients, it will result in receiving a better service. So a brief overview of what we're going to talk about. I'm going to talk about what it is Attract, Connect, Stay and what underpins it, and the research underlying that. The most important thing, so if you walk away today, what must you remember? The 5 Attract, Connect, Stay pillars, and then dealing with the first pillar of Attract and the first strategy. I'll give you some client examples and then talk about next steps. If you have questions, please email me and I'll share those answers with everyone via email as well. So I'm really interested in your feedback. Also, if you'd like me to do more of these and what you'd like to hear from me talk about, I do intend to do more. So just a little bit back about my background. I have 25 years in community development experience, and about 10 years ago I got tired of sitting on the good projects didn't always get refunded, and poor projects sometimes did, and I really believed that we needed a more evidence-informed approach. And so I really wanted to sit on the other side of the table as an evaluator and helping build that evidence base. So I'm a social scientist by training and a qualitative researcher, and I'm a grounded theorist. So what that means is I look at lived experiences of my participants in interviews predominantly, and work out what it is that to explain their experience. Most particularly, this is about what attracts them to positions in rural health and social care, and what drives them to leave or stay. The most famous grounded theorist is Brene Brown, so I'm a bit like Brene Brown, although not quite as famous as Brene Brown. So for my PhD, I really wanted to tell a good news story. So I chose my topic area was why did community mental health professionals, which were mostly nursing and allied health, choose to stay in those positions in a public health service in rural and remote New South Wales. These were the key findings: that job and personal satisfaction were key measures, that newcomers initially feel alienated, because rural communities are welcoming, but we're not always inclusive. But people do develop a sense of belonging if they can get through those initial challenging times. So there are 3 primary elements that most significantly impact job and personal satisfaction. So I found that life stage, career stage, and degree of familiarity with place and rural living are the key factors that influence, and they influence differently depending on life stage and career stage. Another key finding was that everyone experiences a period of adjustment, and it usually lasts for 12 months, depending on the level of experience. Early careers significantly experience the most challenges in the workplace, as we'd expect, as they adjust to their jobs for the first time. But everyone experiences adjustment to the workplace. And for newcomers also relocating, they also take some time to settle in this very vulnerable period, both in the new job and in settling in the first place. So for newcomers. And so another interesting finding was that there was some tolerance for personal dissatisfaction in the first 12 months, that people were really focused on their jobs and settling into that job, they would put up with some dissatisfaction in the personal issues, but that really swapped, and the reason they chose to stay in a position would be that the job was good enough, but that it met all the other factors that were influencing personal satisfaction, and I just want to talk about what they are. So a rural-based professional stay or leave decision, this is the theory, hinges on the gap between their life expectations and the realities of their job and rural living experience. So as I spoke, the professional expectations and personal expectations influenced. So professional factors that were key, and these are well identified in the literature, and my study confirmed them: scope of role, workplace relationships, access to continuing professional development, and career advancement opportunities that were available in the local region or town. And the influence of these varied depending on career stage and time in the job, but all of them added up to professional satisfaction. In terms of the personal factors, social connection was the key issue here, and an assessment of whether the town and community could meet the future life aspirations of both the individual worker and any members of their family who had come with them. So time living in the town and life stage were also strong influences here, adding up to personal satisfaction. And it was a case of people weighing up whether an assessment of whether their expectations were being met. And if they weren't in either of these places, people would choose to not stay. So because I said these three factors were really important, I want to dive in a little bit deeper about the influence of life stage, career stage, and extent of rural familiarity. So in terms of life stage, people's professional and personal interests differ. So this is why over the life course. So in early adulthood, which is roughly early to mid-20s, this group is highly mobile, experience-seeking and experimental. And they're really interested in skills development and support and career advancement opportunities. This career advancement and skills development is a big pull card. And this group, particularly for nursing and allied health, is often they're in this age group if they've gone straight from university. They're very, what's interesting them personally is the finding a partner. And if they don't think your town or your community can assist with that, and they've come as a single person, they're unlikely to stay. So they're very mobile. If you're getting retention of at least 2 years here, you're doing really well. So congratulations. It's a hard group. We might be able to get them to stay for 3 years if we can offer them more around this career advancement. But generally, they're not long-term stayers. On the other hand, this middle adulthood group are stayers, but they're much harder to attract because they've got all these things already to some extent established. This is a more settled down stage. It's often when people will have families. Place attachment strengthens at the entry point we've identified. So if they're already working in your rural town in their late 20s, when they're thinking about having a family, this is when they might choose your town, or this is also for rural people from a rural background, they might choose to come home. Flexible work arrangements, of course, are most important for this group, but for all groups, this is increasingly needs to be a key offering. and career opportunities in place. So nobody across the life course stops being interested in having a meaningful position and career, but this is harder to do in rural, as I'm sure you're all aware. So this group, the main dominating interest is work-life balance, so really having things to offer here that address this need. This group, the senior adults, these are really a key group that I rarely see targeted in job ads, but should be. They're a group that have reducing family commitments, they're more mobile, and they're willing to tolerate a little bit more sort of because if they go to a rural or a remote position, it's not likely to be for the short term. So they're a good contract position. They're excellent if you've got a team of early careers and really need to build their strengths. And they're really interested in leaving a legacy and career consolidation. So they're often sitting in Metro. Don't forget them. You really could target something, a job ad, particularly for those. So important group. Just quickly on why career stage matters, because the less experienced, as I mentioned, the longer adjustment and the more support is needed, particularly so if they're in early career. And these are just the definitions I use. But, as you well know, when people come to work in rural generalism, and the scope of practice that they have to have means that they get very experienced very quickly. And most people I've got within 2 years are fairly experienced. And that's why early careers often come to rural. In terms of familiarity with place and rural living, workers recruited from elsewhere, as you'd expect, need support to settle and connect. So in descending order of the need of support, or ascending, can't remember, but locals don't need much. They don't often speak about this, which is interesting because people from outside the area will talk to me extensively about this, and usually that's the first thing they talk to me. So locals who have been living away or either in a city or another rural regional town, when they return, if they're returnees, don't forget them. They often have settlement needs and social connection needs, even if they have family in place, because their friendship group will have changed quite significantly. There's other rural newcomers. These are a key group. Of course, there's less adjustment for them because they're really familiar with rural Australia and rural living, although they still need to build new social networks. People living in cities need more support, particularly those early careerers who don't have a lot of life experience yet, or increasingly much experience of living out of home. And probably the most tricky and the ones needing, I would sometimes say, 3 times more resettlement support are those that are coming from overseas. So a lot of work to be done in that space. So the single most important thing is belonging, and that belonging in the workplace and community. So what do I mean by belonging? That we create an environment that engages the full potential of the individual, where innovation thrives and views, beliefs and values are integrated. So the things that I am well known for in my research are place-based, person-centred approaches, workplaces that value inclusion, equity and diversity, and creating social connection both in the workplace and community. These things are needed increasingly. People are looking for a sense of belonging, and if you want to attract workers and get them to choose to stay, these things need to be in place. So the Attract, Connect, Stay framework came directly out of my PhD and the findings, and I found that I identified that there were 3 areas that needed to be worked on to attract and retain staff. In the community in place part, feeling settled in, being socially connected and having a sense of belonging. There's the key strategy in this area is the Attract, Connect, Stay, or the Community Connector program, known that there's a website for, and quite a lot of information on if you're particularly interested in that. And I encourage you to talk to me if this is the area that you jumped on today. It's not the focus of today, but it's a key signature piece of the Attract, Connect, Stay framework. Having opportunities to build skills and access career pathways for all the reasons that I've spoken about earlier is really important. Again, I won't be speaking about this today, but this is where I want to focus today, about the importance of working in a friendly, supportive and inclusive workplace, and what needs to happen to attract staff in that place. This is a peer-reviewed framework. It's also known as the Whole of Person Retention Improvement Framework. And here is the reference for that if you'd like to read in more depth about what underpins this. So it was based both on my PhD study and much about the last 10 years of best practice, attract and recruit and retain literature in rural places across the world. The World Health Organization in 2021 released guidelines on rural health workforce, and it's good to see that what I'm suggesting is also being suggested by them. They argue that interventions need to be interconnected, bundled and tailored for the local context, so place-based. In the area that I'm working on, the attract, recruit, retain, they recommend a whole of community approach and the involvement of community and health stakeholders. So I'm definitely in line with the World Health Guidelines. So I've created, by working with my clients since I completed my PhD in 2016, 5 pillars for implementing the Attract, Connect, Stay framework. And this will help them help your staff, new staff, achieve belonging in the workplace and community. And this needs to be done both to attract and retain staff. So I really want to talk today about the attract part of the workplace and organisational framework. We'll talk about in other future webinars, recruit, settle, connect in the organisation, community, and more about stay. So, but today's focus is about attracting a strong pool of ideal candidates. And I just want to identify that the area that the Attract, Connect, Stay framework particularly focuses on is at the individual and the organisational levels. Those global contexts, there are many challenges in the global systems, and we need policy, new policy and government interventions in that space, but that's not the focus. This is really a bottom-up approach, and what can organisations and communities do for themselves to begin to address their attraction and retention challenges in the health workforce area. So there are 2 strategies underpinning the for attracting a strong pool of ideal candidates. And I'm just going to speak today about developing your employer branding strategy and the things that underpin that you need to have in place. So this is an organisational meso-level strategy. And the second part that I'll talk to in the future is creating a tailored recruit campaign for vacancies. I also have a 30-day workforce transformation program that I'll be running in February. I'll put on towards the last slides. You can see those. But if you wish to work closely with me in implementing all of the 5 pillars, this is where we will go in more depth, and I'll give you individualised and organisational support. So what is an ideal candidate for a rural or regional position? It is that they have appropriate skills and experience, of course, but they're also interested in practicing rural and regionally, and that is important to explore both in selection criteria and in interview, and that their interests match well with the assets of the local community and the geographical area. So you really good fit is really important. Good fit for community, good fit for the position, good fit for the team. So employees' recruitment journey looks like this. We want to make sure that people are aware of the job and are eyeballing the job, that they consider the job so that it actually resonates with them and their interests. So those things that I point out across the life course that we know are of significant interest and concern for people, that they're interested enough to apply, and that you interview some who are ideal candidates and you select an ideal candidate. So in terms of the steps for developing your employer branding strategy, there are 3. What will a strengthened workforce look like, and developing some metrics around that. Know what attracts people to work at your organisation, and applying hard to recruit categorisation to vacancies and assigning incentives. So to develop your employer branded strategy, what will your you need to ask, what will a strengthened workforce look like? And set your success measures. We need to benchmark it, like where are you currently and where do you want to get to? So some examples of that are employee turnover rate, time to hire, cost per hire, employee satisfaction, and retention rates. So here's an example of one that we've been working on with our client, the Western District Health Service in Victoria. So as a blunt indicator, we've been looking at the number of jobs advertised per week with this organisation as the impact of the strategies that we're having with Attract, Connect, Stay. So we started in April 2022 and are still going. So we want to see that this is trending towards less orange. So that's over 35 vacancies being advertised, and we really want to over time see this really drop significantly. So this is just one measure we use with Western District Health Service. There are others, but this is a crude one that we look at quite a lot. So as well as setting your success measures, you need to know what attracts people to work at your organisation, and to do this, you need to ask your employees the one thing that they most like about working at your organisation. And this will help you form an employer value proposition, and it's got to be succinct and clear and highlight what's important to staff, capture why they choose to stay, and anything that sets you apart as an organisation. So I suggest that if you're a larger organisation, you can use Google Forms or something to do a survey, and ChatGPT or similar to help you evaluate that and formulate a punchy employer value proposition that goes in all your job ads, job descriptions, everywhere. And then we also want you to apply hard to recruit categorization to vacancies and assign incentives. Categories, the things you need to consider when establishing categories are whether it's a local or relocation will be required for this position. What's the state of play nationally with that talent pool? So nearly all specialist nursing positions for rural and allied health are in hard to recruit categories. And some other things, level of experience, specialist skills, as I've spoken about. So this is also what we created for Western District Health Service, Category 1 is not difficult to recruit to, and that was just generally that would be fairly easily done. But then these hard to recruit to, within 90 days of advertising, we'd expect the position at least one suitable applicant to apply. And for the stubborn to recruit, which I'm sure many of you are facing, this type of, that you've got, no matter how much you're advertising, you're not getting any eyeballs or any suitable applicants applying. So in terms of incentives, we need you to, there's an evidence base about what incentives, you will need to apply incentives. The more work you get to tailor your job descriptions specifically and your job ads for a particular candidate, ringing the bells for their life stage and career stage, then incentives are pretty mandatory there now for relocation. So what we know as people are looking for, you need to make it an even, it doesn't cost people to come rural. So you want to reduce or eliminate out-of-pocket moving costs. Provide, accommodation is an issue in all rural towns. So you want rental accommodation and for landing, short-term, and financial support to cover, or financial support, but really good if you as an organisation can organise that and pay for it. And then wherever you can, support around finding permanent accommodation, and that's what our Community Connected program is doing in a number of sites already. I'll speak about that a little bit more, but not the focus of today. And funding for external professional development if it's not available within the first 12 months. So just to summarise, if you've got stubborn to recruit positions, you must be covering relocation costs. You need to be considering short-term accommodation and housing support. If you consider whether a community connector role or position is suitable for your community and is worth developing and investing in, and external professional development funding in the first year if that's ruled out for them. So I just want to talk to you and show you, this is a client, Dundaloo, that has a community connector program. It's operating in the mid-north coast, but this is a client that I work directly with, and this is what their job ads used to look like. Quite a long list followed this, but nothing very punchy. After they worked with me, they've identified what it is that it is the reason that staff like to work with them. That's honesty, excellence, these types of things, and the betterment of people's lives at its core. So this employer value proposition is now right up front. You can see all these things that weren't here. Flexible working arrangements, there needs to be everywhere because this is a mid-career. Remember, flexibility, work-life balance is key for this group. Subsidised accommodation, relocation support with the community connector, competitive salary, and annual professional development. So some of these things were already being offered, but the way we market them is to really put them up front. People are, we want them to go on that journey, the recruitment journey, and this is the sorts of things they'd be looking for initially, and a good lifestyle photo of how beautiful the Taree region is. So this is what I work with people on individually as an organisationally, on developing a job description that's based on an ideal candidate profile, and we work on these and strengthen the job ads and then track those job ads. Here's another example of what applying Attract Connect Stay strategies the results that have happened. So no need to speak about the efforts, the challenges with allied health and attracting all of them in the Western District Health Service and the Southern Grampians region are stubborn to recruit positions, category 3. So they had this was an OT position, was hard to fill. They had an OT approach them who's had a partner coming for a job. So with this training with Attract Connect Stay, they absolutely understood those social determinants and immediately interviewed and offered relocation support. And so the managers continuing to work with them and provide them with local knowledge and support. People and culture are organising relocation costs and more offsetting that also with salary packaging. Western District Health Service offered, this was a whole family moving short-term accommodation, and the Community Connector for the Southern Grampians is supporting that family with finding suitable accommodation, childcare and a nanny, and that was all done successfully. So that's it for today. These are as you leave, the things you need to remember. The importance of life stage, career stage and familiarity with place and rural living on workers' job and personal satisfaction. And when you're writing job ads or working with your staff, that you consider these things both for attraction and retention. So again, you need to take this person-centered approach. Job, career and personal factors all matter in the decision to take a job and whether to stay or leave. So if you wanted to know more, I encourage you to scan this QR code for a self-assessment checklist that I've developed that'll help you benchmark your organisation against the Attract Connect Stay framework. And then I really encourage you to save those results, book a strategy call with me so that we can go through those and talk about what might be valuable next steps or that I can assist with more in-depth assessment of where I think your organisation is at. And I also wanted to speak to you if you're keen to work closely with me and learn how to implement the entire Attract Connect Stay framework. Remember, we've just talked about a little slice of it today. Strategy, the first strategy or the first pillar and the first strategy related to that. I am running a 30-day workforce program that has limited numbers, so I've got very small numbers that I want with that, because I want you to have a sort of a very individualized service with me. And this is really about applying that framework across your organization and how to get it embedded and the steps to take. If you're keen, I encourage you to scan this QR code, and this will take you to this sales page which tells you in way more depth about the program. So there's an early bird discount for applications made before the 8th of December. So I really encourage you to have a good look at that. That's another step. So a couple of things there for you. You'll have this slide deck. I hope to do more webinars in the future, and please email me any questions you have or suggestions for future webinars. Have a great day. Thank you very much for your time. Best, Cath.